My name's Stephanie Eels. I'm the Chief Financial Officer for Bryan Health. I've been with the Bryan Health system 5 years. As the Chief Financial Officer at Bryan Health, I'm basically tasked with maintaining the financial viability and financial responsibility of the organization. I need to ensure that we have resources to do day-to-day operations for accounting, accounts payable, rev cycle functions, budgeting, and strategic development. What I enjoy most about my current position is the great variability of things I get to be involved in. I'd been familiar with the organization since I was a little kid. I'm being brought here by my father for rounds and got to meet so many great people here, and I volunteered here in college. So when I was back in this community, I knew this was a great place for me. At Bryan Health, one team, one purpose to me means all of us, from the front reception to scheduling to the back business office, we all play a role in caring for our patients.
My name is Sarah Hawley. I work at Bryan LifePoint in cardiac rehab, and I've been there for 10 years. In cardiac rehab, we run rehab sessions for people who have been through, whether they had a heart attack, some kind of heart surgery, and we just work them back to where they feel they're 100%. I love seeing the patients come in and maybe they're scared or angry, and then just watching them day in and day out, and their attitude changes and their health is getting better. They're doing things that they never thought they would ever be able to do. It's really exciting. There are people where they will just say we've changed their lives, and we're just doing our daily job. We don't think we're doing anything special, but we know we have one goal, and whatever we need to do, whatever role we need to play to reach that goal, we're all in it together.
My name is Kurt Schmeckpepper. I'm a physician assistant at Crete Area Medical Center, and I've been there for 10 years. The great thing about being a physician assistant is I get to see lots of patients, especially in family practice, from an 8-day-old infant to an 88-year-old grandmother. I can take care of infections as well as bumps and bruises, mild injuries, or if needed, I can work in the emergency room, and I get the benefit of working with everybody in the hospital. The patients are what keeps me coming back, doing my best to help them with anything they need help with for that day, whether it be maybe just education on the right things to eat to control their diabetes, to maybe a little bit of a change in their exercise program to help them lose weight, or maybe just an ear to listen. I believe that's the talent that God gave me, and I get to use that every day, and that's why I love coming back to work as a physician assistant. I love the core value of one team, one purpose, basically for the fact of the team. It's not focused on just one person. And I guess to me that really makes my role, whatever it is, whether I'm a provider like in Crete, or if I worked as ancillary staff or a phlebotomist drawing blood, everybody's role is important. That's what inspires me to continue to work and improve my role so I can be the best for my teammate, and then I can be the best for the patient.
My name is Doug Fast. I work on the Epic team, and I've been at Bryan Health for over 20 years. In the Epic team, we help set up users, both new users or people who change jobs. We coordinate with all the other components of the Epic team, as well as outside of Epic, to give people the proper access in order for them to do their jobs. What I enjoy most about being on the Epic team is the intellectual exercise of trying to figure out how to give a user something that they need, so the ability to retrieve patient information from not just within Bryan Health, but other organizations across not just the United States, but internationally, is just tremendous. One team, one purpose, to me at Bryan Health means that we're all working towards the same goal, which is essentially providing better patient care, helping people manage their health better. I feel like the EPIC project really is integral to that, and so our role is absolutely valuable.
My name is Janine Worley. I work on 2 South in the Neurotrauma ICU, and I've been there 30 years. In the Neurotrauma ICU, our patients are very critical. We're requiring frequent titration of drips, monitoring their vital signs closely. We do a lot of off-the-floor procedures and radiology procedures, and we interact with families very closely that are dealing with a high-stress situation. One thing I enjoy about my job is a good rapport with coworkers because it's my second family. And we deal with very stressful situations, and if we didn't have each other, we would burn out. They're there to support and to help us through situations because we see a lot of very difficult and sad situations. One team, one purpose, especially where I work, our patients require a lot of help, and we work well together as a team. If we didn't work well as a team, we would not be able to do our job successfully and as well as we do.
My name is Cristina Guerrero. I have been working for Bryan for about 35 years, and I am an HIM team leader from the Health Information Management. As a team leader, I have to make sure that every single piece of paper that arrives to our department, we put it to the correct patients. And one of the reasons is because we know that it's not just a piece of paper, it's a piece of paper that can save a life. I love to train new people. With the little experience that I have, I try to plant that seed toward the employees. That way, it's not just a job that we do, it's something that we are helping the organization to give the best of the care. I believe I work on the best organization in the United States. I am from another country. I can value little things. As a patient, I am so glad to have a hospital in town that cares. As an employee, I care because any little thing that we do to save a life, it shows that we are one team